When I was diagnosed last year, at the age of 28, it was an eye-opening and ultimately beneficial experience. All my life I knew I was different. In my childhood I was diagnosed with many things: ADHD, major depressive disorder, bipolar disorder, generalized anxiety disorder, social anxiety disorder, and so on. I was put on many medications over the years. Even though there were many clear signs that I was on the spectrum, doctors never mentioned it or considered it as far as I know. For example, when my mom or the doctors would ask me how I felt, my response would often be, "I don't know," which is textbook alexithymia. When I was diagnosed last year, part of the process was a childhood history that my parents filled out. Based on their answers, my psychologist was surprised that doctors hadn't noticed. Before the switching criteria from Diagnostician and Statistician's Manual DSM-4 to the DSM-5, I would have likely been diagnosed with Asperger's syndrome, but I wasn't diagnosed until after the change to Autism Spectrum Disorder. My experience with being on the spectrum, though, is somewhat unique. I noticed early on that I wasn't like my peers in many ways. I didn't inherently understand people and their motivations. Society seemed alien to me. Like many people on the spectrum, I dealt with being picked on in school. When you're different, people tend to realize it. I learned early on that I needed to mimic other people in order to blend in. If I copied the crowd, people wouldn't notice that I stood out. I also learned that humor was an effective method for deflecting attention. People like to laugh, and people like the person who makes them laugh, and so I studied humor. I dove into it, as I have with many subjects, and that's when hyperfocus ends up coming in very handy. Every subject which has perplexed or interested me in life, I've studied it in my free time. I've studied myself, and I've studied others. Over time, I began to realize the things that I wasn't very good at. This was long before my diagnosis, so to me at the time, these were just things that I needed to work on. Eye contact, projecting my voice, being patient, accepting change, being empathetic, focusing, not perseverating, listening to other people, and responding in a socially acceptable manner, being aware of my behavior and thinking about how it affected others, and plenty more. Eventually, I got good enough at using these coping mechanisms that it became much less apparent that I was different. I could pretty much blend in with everyone else. I made eye contact, though often it was more eye contact than others, because I still didn't really understand how much I was supposed to be making. I held conversations with people, though I'd come up with a strategy to do so. I paid an extreme amount of attention to everything I did and said, but I still had an issue with understanding people's faces and reading the emotion on them, so I would still often say things that offended or upset people. I did these things passively, but in order to do so, I dealt with an extreme amount of anxiety. Blending in can be unnatural, and it weighs on a person over time. After my diagnosis, I got rid of some of these forced behaviors. I realized that my aversion to eye contact was fueled by anxiety and sensory processing issues, and that I could focus much better by not making eye contact. I realized that maybe that will make some people uncomfortable, but that's a judgment that they're making in their own minds. I firmly believe that I shouldn't have to force myself to be uncomfortable in order to make other people comfortable. Every person deserves to be comfortable in their own skin. In this way, being diagnosed has been freeing because it allows me space to accept some things that may just always be difficult for me. Since then, I've watched a lot of documentaries and read a ton of blogs and forum posts. I still try my best to be polite and patient, but I don't force myself to make eye contact anymore or spend time around others if I'm feeling uncomfortable. Well, thanks so much for watching, thanks for coming by, and have a good day. Hey everybody, Ultimate Oddball here. If you want to stay up to date with my videos, click subscribe. I release a new video on Monday, Wednesday, and Friday. I do gaming commentary and review. I talk about my experiences on the autism spectrum, and I share my opinions and thoughts on a variety of matters. My hope is that, through my videos, I can help to dispel some of the misinformation, confusion, and negativity people have regarding autism. Thank you for helping me do that by watching these videos.